This is Harley Street, home to some of Britain's best cosmetic surgeons. The shiny black cars and neat bushes may look pristine, but behind these solid oak doors, these doctors are cleaning up more and more of other people's mess. The results of cheap plastic surgery holidays. Jacqueline Lewis is a trained breast and plastic surgeon.
There's been delayed wound healing and infection and copious amounts of discharge, going back to theatre several times. It's really something that people do need to know about and take seriously, and to weigh up what they're going to gain from going abroad.
The risks involved in these types of operations are high, but because surgery in other countries can be up to 60% cheaper than the UK, they are often ignored. According to a BARPS poll last year, nearly half of people would consider having cosmetic surgery, and of these, almost all would have it done abroad. However, over 2/3 would not consider cosmetic surgery outside the UK if money were no object. Paul Harris is a consultant plastic surgeon for the Royal Marsden Hospital in central London.
Patients feel in the short term certainly there's a money factor there, and there's money to be saved. The money to be saved is not huge, I have to say, when I talk to patients about how much money they've saved, but it is certainly there present, and that's the main drive, I think. And although they may perceive it to be a short term saving, actually for a lot of patients it costs them a great deal more money to have things sorted out.
In the BARPS survey, 4 out of 5 people said that if something went wrong they would turn to the NHS, but the NHS will only help if a patient's health is at risk. So if the outcome's not unsafe but just unsatisfactory, the National Health Service is not going to correct it.
9 times out of 10, we hope, surgery will go well, but what about those people who develop a complication? And we see them all the time. We know that with any sort of surgery there are risks and complications, and it's well known that they happen. So that's when the trouble starts. Who's going to look after them, and how are they going to be treated and cared for?